Why don't you do a quick introduction, then hand it over to Heidi?
Yeah, that's a good idea. I didn't, might not have.
All right, I'll give you.
So today Heidi is going to be doing a presentation on WASH in healthcare, and this is based on her experiences in Malawi. And do you want to do, Rob, were you talking about introducing members to each other? Because we don't really need.
Well, I was mentioning introducing Heidi, but you could do the same.
Yeah.
If you...
I kind of forgotten about that. So actually, before I'm going to.
Okay. Well, it's great to hear everybody's background, and I'm not at all intimidated presenting about a WASH in healthcare technical systems approach to a bunch of water engineers. But thank you for being a part of this presentation. This will be the second time, and there were some great questions and feedback that I got from the folks on the first call. And so I will pause intermittently for you all to add questions or even comments. It was really valuable, some of the things that were brought up in the last call. So I am I'm really open to your feedback, and so glad that I've got such great expertise on this call. Freshwater Project International, we started out. We started out really grassroots, working in Malawi in villages, then through a partnership, through one of my mentors, another Rotarian who has an expertise in the WASH sector and global health, Steve Werner, who many of you know. He connected us with Procter & Gamble and a program through WashRag, which is the Water and Sanitation Rotarian Action Group that this club works closely in alignment with. And we started a WASH in Schools program, or I should say, we were chosen as the implementing partner in Malawi for the WASH in Schools program. The other country that's part of this partnership is actually Nigeria, and Nancy Gilbert oversees that. So that's kind of the sister project to it. We have completed a pilot at 5 schools. We say comprehensive WASH. That means a new water point, hand pump, operative hand pump at the school, at a school that has not had any close water source before. And then sanitation facilities, latrines, and urinals for both boys and girls, and menstrual hygiene station for girls, and then hygiene training, hygiene, hand washing, and menstrual hygiene management for the older girls. And then Procter & Gamble's kind of skin in the game is, along with some funding, is providing the P&G purifier of water packets, which are similar to WaterGuard, that are distributed for a year to all the students. We distribute them quarterly. And the students then take those home. So it's to purify water in their homes and to kind of share the message, the importance of clean water and hygiene to their families as well. So kind of using the students as change agents to communicate the connection. So that's our WASH in Schools program. And then my former life, I worked for Project Cure, which does medical supplies and equipment to health centers all over the world. And so I worked there for many years, and through that kind of found out that water is the other side of healthcare in many developing countries, that many of the people who are in these health facilities, going to these health facilities, are there from preventable waterborne diseases. And then often at the health centers, they become centers of infection rather than centers of health, because there is often not clean water available, accessible at the health centers. And so I always had in my mind that I wanted to do wash-in health centers, and it's all kind of come into fruition the last 2 years. I knew that our capacity and expertise were limited, especially with the technical part of it. We own a drill rig that's in Malawi, and so we're able to drill, and we have the expertise to do a hand pump and some basic systems. But all of a sudden, we're talking about large amounts of storage, distribution systems that needed to be completely rehabilitated and upgraded, and then going into the health center and all of the fixtures included. So it was a lot more sophisticated than what we had ever done. And so we called in our friends at Engineers Without Borders USA. They're here in Denver, Colorado. The way that they're set up is, and you're probably familiar, there's university chapters at most of the larger universities that have engineering programs. And then there are professional chapters in most of the big cities. And then there's kind of a third leg of or a third branch of what they're doing called the Engineering Service Corps. And these are your very seasoned, traveled, professional engineers who have lots of experience in international travel and working in some of these more remote developing countries. And so while the other two focus usually, I think, on projects, Engineering Service Corps can provide expertise in more of a program capacity. So we called them in. They put together a fabulous team for us, and it's provided not just the technical expertise that we were lacking, but also a lot of project management tools and frameworks that we really couldn't have done on our own. So shout out to our EWB USA Engineering Service Corps team. I know that they are also open for other partnerships and projects. So if you do want to be connected to them, please let me know offline, and I'm happy to give you the contact information. With many of you, you could probably be ESC members, but just know that that resource is out there and available, and it's been really helpful to us. So this, some of this might seem really basic to you, but this presentation I do to a wide variety of audiences. So obviously clean water, safe sanitation, staff hygiene practices are essential to providing basic health services. The most vulnerable people, the most vulnerable folks and patients at these health centers are pregnant mothers that are ready to deliver, newborns, new mothers, and then those with trauma, burns, open wounds, those having surgery, and the disabled. These are just some pictures I pulled that shows kind of a standard of what you see. In Malawi in particular, we'll see a lot of women waiting to give birth, waiting outside, inside. They usually don't get a bed until they are just a birthing bed or a birthing chair until they're just about ready to push. And so you see a lot of women gathered many times outside. And so the Malawian government under Joyce Banda, it's been, 4 or 5 years now, I think. But she had an initiative called the President's Initiative on Maternal Health and Safe Motherhood. that built these really beautiful maternal waiting shelters that are basically dorm-like facilities that are that were built so that women have a place to stay outside of the away from the elements, and they were built oftentimes with sinks and showers and flush toilets, but nobody hooked up the water system. They would just say, we built this, here is our gift to you, and then nothing was ever hooked up. So, it's a nice shelter, but not, there was no functioning water system. So originally we thought, oh, well, we'll just find the centers that have these, we'll hook into the already existing system, and then it'll just be a focus on prenatal and maternal health, providing water to these shelters. But the reality on the ground, what we saw was a lot of water systems in complete disrepair, broken pipes, leaking pipes, broken storage tanks or leaking storage tanks, galvanized steel piping that was corroded. All of the centers we visited had a water source originally, but there was some sort of failure mechanism. And so, a lot of broken fixtures, broken pipes, that kind of thing. And it became obvious really quickly that we needed to look at repairing and upgrading the water system for the entire facility. Many times if there was a breakdown in the provision of water, then you had staff utilizing their time to walk long distances to the closest accessible water source, which was often a community borehole, and that was taking time and effort away from the staff. Also, open containers that were open to contamination, a lot of unhygienic sanitation facilities. I'll show you pictures. It's, just even imagining that at a health center. And then just kind of a lack of knowledge or the water and soap to practice staff hand washing, and just a lot of dirty parts of the health center. So, and that was usually, the excuse was usually, that there was no funding for disinfectant materials in their budgets. So health facilities without proper wash infrastructure were becoming these centers of infection rather than centers of health. And people were not motivated to go there for giving birth or for treatment when they knew there was a possibility of becoming sicker or getting an infection. So here's just some pictures of things we saw. A lot of jimmy-rigged fixes, a lot of just disgusting and dirty fixtures and toilets, and then treatment without clean hands or gloves. This is an example of some galvanized steel piping that we pulled out that's corroded. And then just really disgusting and unsafe sanitation facilities. So that's a latrine at one of the centers where we intervened. Here you can just see the poop on the walls. I mean, just awful. A lot of women waiting outside to give birth. Just more pictures of those that are most vulnerable in these situations. So improving wash conditions at health centers can help prevent infections and the spread of disease, protect the staff and patients, uphold dignity, increase trust and uptake of services, encourage prenatal care and delivery, increase efficiency and decrease the cost of service delivery. So we embarked on a pilot project in Malawi. We did a scoping assessment of, I believe it was 18 health centers with maternal waiting shelters throughout the country. And then we zeroed in on 6. And those 6 were chosen based on a decision matrix focused on need and also involvement of the district health office. And then each health center is supposed to have a community health or a health advisory committee made up of community members. So that's the HAC. So the involvement and engagement and enthusiasm of the HAC and the DHO were part of why we selected these 6 out of the 18. And they're kind of throughout the country. So you can see Machinji in the central west. That's where Makanda was selected, and then a couple of around or just south of Lilongwe, and then one down in the area of Zamba. All of them rural second-tier health centers. So here you can see the Health Advisory Committee and some of the hospital staff, and one of our engineers, the silver haired gentleman in the back with the beard. That's Larry Sweet. He is a civil engineer, and he was one of our team members who went originally meeting with the health advisory committees and doing an in-depth technical assessment of these water systems. So the program components, we started with the scoping assessment, then we did the more in-depth technical needs assessment. For the low-hanging fruit, where the failure mechanism was a pump that had failed or some basic repairs, we kind of started with those. And then several of the health centers needed just entirely new plumbing distribution systems, new tanks, and we also installed some valves and some monitoring systems. You'll see more pictures and examples of those coming up. Storage upgrades, so adding tanks if they were needed. And then a really important part of it for sustainability was the training and knowledge transfer. And this kind of shows sequentially, but really it started even at the beginning with the Health Advisory Committee, the staff, and the district health office plumbers as we were doing the original technical assessment. So they were learning as they went along, being trained as they went along, and then we did an official preventative care and maintenance training that the DHO did with the Health Advisory Committee. Then we do a handover ceremony, really handing over the responsibility, and we'll continue with a monitoring and evaluation program for the next 3 to 5 years. This was just an interesting statistic that we found that, we saw the need that really at health centers, we didn't have to drill. There was usually a well. We do a well test, to kind of test the capacity of that well. But there's a big focus in Malawi, at least, and those of you who have worked there are probably familiar. About 90% of the funding for projects goes towards new projects. So a new well in a village or a new well at a school. But only really 10% of the funding is slated to go towards maintenance or rehabilitation of existing systems. So that was really interesting to us, and I think an opportunity that we saw. So the scoping assessment, I talked about that already. This is one of the maternal waiting shelters. Just these beautiful brick buildings that were built. You can see they're handicap accessible. Right next to the health centers on the same campus, but no water system provided. So this is the head of the Engineering Service Corps, Kevin Andrzejewski, doing just the original scoping assessment, meeting with health center staff and with the DHO, looking at pumps, kind of walking the entire system, doing kind of an overview of what might be needed. We saw a lot of broken pipes, broken fixtures, just some other photos there. So in the scoping visit conclusions, we saw that it was really the entire health facility that we needed to look at, not just the maternal waiting shelter. And the most urgent need was for the provision of clean water for the whole campus, for the whole health facility. So we were talking even larger scope than we originally thought with just one building. So we then brought in some of our engineering team for a more in-depth technical needs assessment. And I put some of these pictures in here just so you can see the partnership of it, meeting with health center staff and DHO plumbers, really focused on building the knowledge and technical capacity even from the beginning. So here you have Larry. He's looking at everything from the electrical supply to the pumps to the distribution systems. This is Henrik, our country director, with Larry. They were doing a pump test, a well test at one of the facilities. And you can see once the water started running, the women came and wanted to take full use of the fact that water was flowing right there at the health center. So I'll just pause there, and if anybody wants to hop on and ask any questions about that first part of our process. No? Okay. Well, then I'll continue on to the project implementation component once we had really a better idea of what the technical issues were and some basic data. Then we brought another engineering team in to work alongside of the DHO, and then you can see Henrik there. This is Philip Woolstenholm, who is a principal at Brown and Caldwell in Atlanta. He's a water, wastewater expert. And so he was another team member that came in to work alongside with the local folks in Malawi and working on that solar powered pump there. So you can see this, some of you probably recognize, I think that's a Grundfos pump, new pump that we purchased for this facility. So they are hooking that up here. Not all of the facilities needed a new pump, but there were several that either that was the failure, one of the failure mechanisms. Here we've got the DHO plumbing team from Machinji, and just showing that we're bringing in these local experts. It's not just us coming in from the US and doing the implementation, always working alongside and utilizing their on the ground expertise and available materials. All of the materials are purchased in Malawi and utilized on the ground. I do want to mention, and I'll talk more about this when I talk about the technical manual that we're developing, but we're putting into place some standards for these systems as far as sizing and some of the control mechanisms and valves. So we utilize local folks to help with some of the manual labor. That's part of their buy-in. Each of the communities is kind of tasked with digging and providing sand for bricks if we need to do a new storage tank. So it's part of their skin in the game. Then you've got the local plumber kind of explaining to his team how these are installed. Just an example of some of the new systems that we're putting in. It's HDPE pipe, which I'm told is a little bit heavier and more durable than PVC. So we replaced much of the galvanized piping with a whole new distribution system of HDPE pipe. We provided this a toolkit with some basic tools that we leave with the health center, so that there's never an excuse that they didn't have the right tools or equipment to make these repairs, any repairs that are needed. You can see we're not just looking at standpipes, although we do many standpipes outside of the facility for patients to access, but we're also going into the facility. And so that was a big change for us, to have to think of it in a systemic way to multiple buildings. This is our beautiful manifold. All of these valves are, or all of these kind of different branches are going to different distribution systems at different buildings, and then a valve at each to where you can shut off supply if there's an issue in one without compromising the entire system or having to shut off water to the entire system. And then you can see, you know, working alongside the medical center staff in partnership was a big part of what we did, and I think a good best practice for these implementation, because when you work in a village, you know, it's easier to kind of do the community-based development. A school is a little different, because most of the schools we've worked at are government schools, and but it's still seen as a community resource. If there's a hand pump at a school and your children are going to that school, and often that's used as the closest, used by the community if it's the closest water point for them. So they still have a lot more buy-in at schools, but health centers, at least in Malawi, the real attitude by the community is that this is the government's problem. And so working with the health center staff and the community health advisory committee from the get-go to get their buy-in, to enlist their involvement, it's really kind of the art of the art behind the science of putting together these sustainable programs. So the preventative care and maintenance training was just a vital component. I mentioned from the beginning, we pull everybody together in this and make them a part of it. This was a really brilliant idea by our Director of Operations, Zoe Pacciani, who worked with our engineering team to put together a basic preventative care and maintenance manual. But she then handed it over to the district health office plumber and said, you do the training. This is your responsibility. You do the training. So again, it's not us or our engineering team from EWB kind of top down. It's the DHO taking on that responsibility, and they really loved it. They really felt empowered by that and took hold of that. And so here you can see the DHO plumber handing this over and going over it step by step with a member of the health advisory committee. kind of walking them through the entire system. And Henrik, our country director, is off to the side, just taking pictures and kind of overseeing and supervising. Same thing with our engineers. Here, the hack team is learning how to just do a simple repair. And so they remove the, what do you call that, a spigot? They remove and then replace. So getting some hands-on training. And again, it's the DHO plumbers showing the Community Health Advisory Committee. There's our toolkits that we provide to each facility to be kept at the facility. And then the handover ceremony. It's important to celebrate the success, but also do, kind of a ceremonial handover where we're saying, it's wonderful. We've got this running system now. We know how to maintain, and we know the process for any larger repairs. And we've done this together, but now it is the responsibility of the district health office and the community to continue to maintain it. And so we get everybody together. This one individual project at this health center was a Rotary project. So we've got local Rotarians, health center staff, community health advisory committee, and DHO folks, and just some other folks from the community at the handover. And then you can see the results are happy staff members and patients who have clean water access right there at the facility. And here you have the staff member able now to wash his hands right inside the facility. So the operations, maintenance, and monitoring, along with kind of ongoing oversight and training. Right now we're doing quarterly unannounced visits to see how the systems are doing, and then the EWB team, two of the engineers, will be coming out in April to do a more in-depth kind of review of the systems to make sure they're being properly maintained and utilized. So there were several challenges to this. I just kind of highlighted the major ones, but funding for equipment and supplies. We're a kind of grassroots, smaller scale NGO. EWB is larger, but most of what they are providing is their technical expertise and paying for their engineers to travel. And so the funding for the equipment and supplies was really, the onus was on us to find either in-country or finding partners back here in the US. And so that is kind of slow going when you're starting a new program and trying to build some momentum and a knowledge base. The HAC and DHO engagement and accountability kind of had different experiences at different health centers with this. Sometimes the HAC was super involved and proactive. Other times you would ask for them to arrange something or do something, and there wasn't a lot of follow-up. And so we took note of that in the pilot, and you'll see in our next steps, those that were engaged will be rewarded with further projects in their districts. And then the sustainability model development. This was really kind of a trial for us. There were a lot of learnings with that preventative care and maintenance. Other challenges obviously was communication, cultural differences, And then the challenge of people perceiving that these health centers were really, the government's responsibility. So again, if we had a hack that was that really got it and was engaged and did their part, we took note of that. The other challenge that's Rotary specific, on one of the health centers, Makanda, I raised money here in District 5450 in Colorado because that's where all of my Rotary contacts are. And our club wasn't yet doing projects. And so I did a district grant through the district here. And for those of you who have done Rotary projects, you know that for district and global grants, they like the funds at least to go from Rotary to Rotary. And so that local club involvement in country is extremely important. In Malawi, it's a little bit of a challenge because there's only 4 clubs. In Nigeria, I think there's 100 something, and they're very active. In Malawi, there are clubs in the major cities, and it's a little bit more difficult and just a totally different culture. And so there were some struggles in communication from our lead Rotary club here in the U.S. and the Rotary club there. Nothing that wasn't above board, just kind of a different cultural perspective of time and communication. So a little more laissez-faire in Malawi on responding to emails, and not a lot of understanding on this side of the water as far as having patience for some of those cultural differences and how to work together in partnership on those. So hopefully that was a really diplomatic way of saying that. Key learnings, that trainings and any kind of technical information needs to be really basic, visual, and hands-on. Sometimes the folks that we're working with in the communities can't read English or don't speak English, and so really a lot of pictures, diagrams, and hands-on assembly and repair training, and not big, long technical manuals with complicated data and technical details, at least for the preventative care and maintenance training. For the DHO plumbers who have a little bit more technical capacity, you can go more into depth. Then I mentioned setting system standards, including pipe sizing and design layout. And then regular monitoring within the first 2 to 3 years at least, continuing with the idea that there's monitoring and ongoing training going on as issues come up. And that really, it takes a lot of patience because the preventative care and maintenance of these systems at these facilities, it's really a long-term mindset change. And really continuing to engage with that health advisory committee and the health center to understand the importance of and their responsibility in maintaining these systems and knowing where to go if something breaks. You don't just call the DHO and they don't come for 3 years and you just don't do anything. There's a really step-by-step, easy to understand system in place for each level of any issues that might come up, and who to call, and who is responsible for those issues. This is another kind of fruit of this partnership that has come about. We really saw the need for a technical manual for rural health center water distribution systems. There's several great programs like WashFit, and I think there's a Clean Clinics program that do everything from assessments to really looking at the hygiene component and waste and sharps disposal. different aspects of it, but we really didn't see out there a technical manual that could be utilized by folks on the ground. So we are putting one together. We're going to call it Wash Tech. And it will be specifically for small rural health center water distribution systems. We're going to beta test it on the ground in Malawi, but then hope to open source it. And it will provide technical recommendations and standards in how to assess, design, manage, implement, and maintain a water system at a health center in a rural area. So easy to understand, again, step-by-step instructions, highly visual, still promoting quality standards, but that can be utilized in a variety of cultural settings. So designed for use by local plumbers, whether they be DHO or private, NGO water techs, and small private sector practitioners. So really building the local technical capacity in country. So next steps for us as a district-wide scale-up, we chose Zomba District because of their involvement in the pilot and their engagement and excitement towards it. And so we've signed an MOU with the group to do 23 health center water system upgrades over the next 3 to 5 years. So the goal is for reliable, clean water running in every health center in Zomba District, being able to sustain the system through regular monitoring and maintenance of these systems. And really the idea too is after the first several, that the whole process, the implementation process will be, can be taken over by the Zomba DHO. And they'll be trained, they'll know the ins and outs of how to do a new water distribution system or repairs and from scratch. And so we will gradually hand the implementation part of it over to them. All right, well, Q&A. Any questions come up for all of you technical experts out there?
No real questions, Heidi, but I've got to commend you on your process. And I really love the comment about skin in the game and ownership. Mm-hmm. Without sense of ownership, you can't expect sustainability at all. And getting them to actually provide some of the services, such as, you know, if it's an issue of digging a ditch for the lines or whatever, that just really increases that sense of ownership. And ownership is so important in projects.
Thank you. Yes, and you know, it's a challenge. It really is a challenge with these health centers, because when we were doing the assessment, you know, some of the facilities would say, oh yeah, our pump broke 3 years ago. We called the DHO, but they haven't even been out here in 3 years. You know, they just kind of sit in their office and do whatever it is that they do, but they haven't been, you know, hands on the ground, or there hasn't been a line item for that that finance part of it. So it's a delicate balance of, I don't want to say, well, I'll say of holding people accountable to what is their responsibility, working alongside them and making sure that they have the knowledge that they need. But they're held accountable, and Zoe, our director of operations, she's just an expert at this. She's actually a Kiwi. So for those of you from New Zealand, you'll appreciate it. She's not an engineer, but she's got a lot of engineering expertise, and she's really good at holding people accountable, in particular men in developing countries. And I've heard it's quite a sight to see how her process in that. But it's apparently quite effective.
As a representative of my gender, I appreciate that comment.
Mm-hmm, mm-hmm.
But you're right. Unfortunately, sometimes it seems, from my experience, that it's the women that take more, at least value these things more than the men, which is sad.
Yeah. I mean, water is a women's issue, and even thinking about these health centers, it's women are the ones who give birth and or go there for prenatal care, and oftentimes it's not just one or two babies, it's maybe 10, and so they're utilizing these health centers. They understand the value of it, and and so they, especially in Malawi, because of some of the gender issues, water is really seen as a woman's issue, and so they often are the first to really step up and show interest and be a part of the process. So, which is important.
Yeah. Heidi, I'm curious if you can tell me how many of these facilities had power, or if they all had power, or if power was an issue at the facilities themselves.
Yeah, it was different for each one. Some of them had grid power, but it's extremely intermittent in Malawi because it's hydropowered, and these are really rural. So some of them were on the grid. There were some solar systems that were broken that we had to repair. Others we added additional solar panels for more power, and I think that's really, at least in Malawi, in the areas where we're working, going to be kind of the best practice. Is even if they are on grid electricity, it was often intermittent, and so we're gonna we often replace or add in with solar. So maybe 3 of the facilities, we replace the entire solar system.
Great. And what were the facilities doing for disinfection?
Not much. Not much. So that is still, it's still a challenge, because you'll hear a lot of excuses like, oh, well, the DHO didn't provide us funding for it. But all of a sudden they have water, and, Zoe will kind of go in and chastise them that, like, look, now you've got the water, you're saving a lot of money here. And so, let's clean up this mess. Let's keep this delivery room clean. Let's, we saw a lot of just trash around and unclean, it's like, now we got your toilet hooked back up, so let's keep it clean.
Was the question oriented towards disinfection of the water?
No, I mean more disinfection within the facility. So how are they cleaning the facilities? What are they what are they using? Are they not at all? Do they have supplies of chlorine, or is that not available?
Well, so the water quality is an important thing, and I was asked that by a surgeon who's also a Rotarian here. Are you testing the water? Is it medical quality? I think what we're going to be incorporating, and I've been in touch with a colleague who is a chemist and works for the government. He's a water quality expert. He's going to be connecting us so that we can do some water quality testing, and then but I think we're going to standardize it to add chlorination systems to all of the facilities. But yeah, the cleanliness and disinfectant part of it, that's really on each facility, and it was kind of different for each one. Here you see, you've got a nurse or somebody who has, some gloves and is getting some water to do some cleaning. But as far as, do they have the supplies for the disinfectants? Do they have access to it? Do they have soap? It kind of varies for each facility. And I will say that I think it's Wash Fit and the Clean Clinics program. They focus a lot more on those aspects of it. So, in the future, it's kind of partnering with folks, that's more of their focus. And, because all we can really do, we're getting everything up and going, focusing on the technical part of it. We can, kind of give a little chastisement, like keep it clean. But as far as monitoring that, ongoing training, and oversight of that, is kind of outside of our scope, at least.
Yeah. So Heidi, I want to comment on this. I'm going to put on my software hat again. Yes. This is awesome. What you've done and been able to accomplish is amazing. And what we've always found is the breakdown is that the technical stuff is really the easy stuff. That software is the management piece of it. Mm-hmm. That's always the piece that's broken. And right. Even though it doesn't show up like a piece of broken pipe or a broken pump, it is right. That software side of it. So like if you had a picture of the latrine there with the poop on the walls.
Right.
And is that at the same facility where you did all this work?
Well, we did 6 different facilities, but it's at this facility that I'm showing right here.
So when I'm just going to say this and with no malice intended.
Sure.
When the question of disinfection comes up and we immediately go to conversations about chlorine or this or that mm-hmm. or anything else. And it's the most simple way for that to show up is that the poop is wiped off the walls because they have access to water. If they can do that, if they're doing that, then everything else is easy. I mean, there's always some simple thing. It comes down to if all they had to do was push this big red button and everything would work for the day, mm-hmm. would they actually go push that big red button? Mm-hmm. And there's simple ways for that to show up, right? If they're about it being disinfected, you're not talking about the whole facility, but this. Yeah. Are they actually mopping the thing out? Are they actually mm-hmm. keeping and cleaning it? Because then if somebody's about that being swept and clean, and then you can work with them to do the job better. And that right. might be chlorine or whatever else. But whatever that is, that software side of it is, to me, is always the key. If you can figure that out, then everything will go gangbusters.
So maybe that's part of the technical manual you leave with them. It's not just the maintenance of the plumbing and all that, but you actually begin to talk about hygiene and having a maintenance program of some sort.
Yeah, I think they are putting in a maintenance checklist. So, but I'll find out, as far as facility maintenance, if that is included. But it's a great comment, and I appreciate, based on your experience, how incorporating software and some of these practices they're vital. It's just as much about sustainability as providing the water.
Right.
Yeah, and to kind of piggyback on what Neil was saying, Heidi, I think this is really a huge problem we see around the world. I've seen this a lot in Malawi, Haiti, everything in between. I was just in Ghana a couple of weeks ago, and the same problems. It's what I always say. If people don't think they have a problem, we can't solve it for them. Right. So in other words, is there a felt need? And poop on the walls is because there's it's not, I mean, even if you have dirty water, you can wash that off, right?
Mm-hmm.
That's not an issue of clean water or not. That's an issue of, do they think there's a problem? And we look at that and they're disgusted. And others are willing to live with that for whatever reasons. And those are complicated reasons often. But it's often also a matter of trying to create solutions, whether they're software or hardware, that theoretically make it easier to do the quote unquote right thing versus the wrong thing. Cleaning the walls is the right thing. How can we make that easier for people to do, where they would prefer doing it that way versus an inferior way, whatever that might be.
Right.
And
well, this latrine in particular is a patient latrine. So at a lot of these facilities, there was a flush toilet, whether it was working or not. But there has been maybe less buy-in when it's outside, it's kind of out of your view, and
I'm not trying to point fingers at that individual latrine. It's not so much that as it's like the light bulb test I told you about last week, right?
Mm-hmm.
I'm not worried about the whole facility. I'm worried about this light bulb. And if it burns out, who changes it? Where does the money come from? And where do they buy it?
Mm-hmm.
Yeah, what Greg brings up is sort of a cultural thing. I mean, it's broader than just the latrine. It's really kind of a cultural acceptance of the way things are now in their area. It's people die. They get sick, they die, and we're coming in with a Western mentality. You don't have to get sick. You don't have to die. But I've seen a number of communities where you as you're trying to change things, there's a certain inertia because, well, that's the way it's always been. I mean, it's kind of this mentality of, people just die, and there are diseases, and here we are as Westerners coming in and going, but that doesn't have to be that way. And trying to move that ball, it can be difficult because it's so ingrained.
Yeah. Well, that's why I said it's a long-term mindset change. And that's one of the challenges. I've been trying to work, even recently with Henrik, we had a basic village borehole that we did. And my big thing the last several months, is really looking at the apron and the soak away. Because some of the communities just...
What was that second word? The apron and the what?
A soak away. So it'll have like an apron drainage kind of.
Oh, soak away. Okay.
Yeah. And I started noticing pooling water and mud and kids without shoes on standing in it. And so I had to really reaffirm to Henrik, okay, we need soak aways at every single every single water point that we do, every single hand pump or even standpipe. If we need some sort of drainage, I don't want to see another picture with pooling water. And so Henrik was kind of, telling the communities to do it, but he wasn't overseeing it. And so they would put bricks. And so then I started seeing all these really dangerous bricks kind of piled up around being used as soak away. And so I had to say, okay, go, I'm going to send you money, go get some gravel. And I found a diagram and a picture and, how far to dig and put it in there. And it took a process, even for Henrik, who's involved in water and sanitation, to really be able to work with the communities to get this done. And the last one that we did, really they did the soak away just fine for drainage and then soak away, but really we needed gravel around the entire apron because of the rains. It had kind of just formed a pool around the cement, and there's kids standing with bare feet in pooling water. And so I said, okay, get gravel and put it around the entire soak away. So
I'm laughing because I've lived through this conversation hundreds of times, and what exists as a problem for you does not exist as a problem for them.
Well, right. They're like,
right?
well, we got water.
And
It's here.
what we do is you try and find ways to make it exist for them, make that breakdown exist for them.
Mm-hmm.
And it's things like this, like, so when they see clear water, they see a glass of clear water, that's clean. And they understand, they think that that's clean. That's where their mindset is. They can't see the bacteria, so that water is clean because it's clear.
Right.
And what we do is do things like pick that glass up and then say, oh, would you drink this? And they would say yes. And then you reach down and grab a little bit of dirt and drip it into the glass and stir it up so they can't see it, and then hand it to them again.
Mm-hmm.
And they'll never drink that.
Right.
Even though they can't see it. So it's just one way of triggering in their brains that there are things that we can't see that can hurt us.
Right.
So, that finding those triggering things is the key to the software component, right?
Yeah. Yeah. It's a whole different aspect of this as I'm learning. And so
you'll push on it for a long time, and it'll be a long, like you said, you recognize it's a long deal. You push on it, and all of a sudden one day it'll just switch on, and you'll go, oh, there it is. Right? Now you got it.
Yeah.
Heidi, you might be familiar with the Climate Justice Fund study in Malawi that you've Strathclyde's put on for like the last 10 years.
Yeah, I'm not familiar, but go ahead. Tell me about it.
It's a fascinating body of information that they've collected on water points and functionality and the reasons for functionality and so forth across. I think they've mapped half the country now, something like 27,000 water points.
Wow.
And they found all the things that I think most people on this call would already know just from experience, but they have data to prove it. 60% of water points are functional. 7,000 or 8,000 water points are seasonal, meaning that there's no water for 3 months a year. And the thing that I always ask when I think about water points is not so much the technology either. It's the question of uptime and impact. So I think those are directly related. And O&M is a huge issue. A lot of groups this seems very simple, like give the community a box of tools and some parts and life will be good. And we've run into this already, even with our trusted partners. They come back a year, 5 years later, and those tools, give them 10 tools and one might be still there.
Right.
And they're jerry-rigging stuff. They're, but then they're putting the wrong O-rings on things. They're doing, they're using the incorrect parts. And that's, if you go back to the Climate Justice Fund study, the O&M of even submersibles, the functionality of submersibles, which is considered extremely high because submersible pumps themselves are very reliable. The power systems are the issue.
Right.
They're still like 60 or 70% functional. And it's because of operations and maintenance. It's because of ownership. And it all boils down to value proposition. People have money. They don't have a lot of it, but they have money. And the question is, what are they spending their money on?
Right.
Do they value this enough to keep it maintained 100% of the time or 80%? If it's 80% or 90%, the impact is drastically different than if it's 100%. And those are very complicated questions that we keep wrestling with ourselves. And the truth is, it always costs more money than we think it should. Whoever decided those gold standards of, cost per beneficiary. Everybody has a number, and most organizations, that you have to really dig for it, but there's a number. Every organization says $20 a person, $30 a person. And sometimes for $10 more per person, it can mean the difference between night and day.
Right. Yeah, we're really looking at that, and it's interesting. There's I don't know if you're familiar with Lakoma Island in Lake Malawi.
I'm not.
Okay, so there's 2 islands. I forget the other name of the island, something with an M. It's a little bit smaller, but Lakoma Island was the kind of missionary headquarters for the Anglican Church years ago under David Livingston.
Yeah.
And so there's a giant Anglican cathedral, and then there's a large mission hospital. And so through some contacts, we are looking to work with the community, and I have a potential grant that I'm writing on this water system. But part of the grant, they want us to do a community listening event to know, is that even a value? Is that even what they want? Do they even, understand the value of clean water at the health center, or are they going to say, oh, that's fine, but we want it in our village. We want water in our village because that's something day to day that we deal with. And I'm interested to see. I think that's going to take place this weekend, but I'm trying to work to put together what the questions are for this kind of focus group listening event. To really look at, is this something that they are going to value? And
are you putting those questions together, Heidi? Are you doing that?
I'm working with a gal here in Denver who has done some similar studies.
We should talk about that, because it's really the crux of our whole program.
Oh, great. I would love any input.
It's exactly, what Greg's describing is exactly what you find everywhere in the world. 50 or 60% of the stuff working.
Right.
And when we started dealing with this back in 2005 as a management breakdown, as a software issue, overnight jumped to 90% of our infrastructure working.
Wow.
Right? Not like little by little, but just like from one well to the next. All of a sudden it all started working. And it really is, it's exactly these conversations. And so I can't give you the exact questions to ask. So it's more of like a mindset that you're in about understanding the conversation that these people are in and what their world is. That's what I love, the word that you use there, a listening conversation.
Yeah, it was, they brought up this in the grant call that I'm looking at through the Episcopal Church here in the U.S. They said that would be an important component to include, and, really looking at asset-based community development approach to it. And so I'd love to have an offline talk about that. Any suggestions that you have for how to frame these questions? Because I don't want them to be leading.
Exactly, right.
But, is it okay to, as part of that listening event, include an educational component or a discussion at least of, here's why. I don't know. So
you need to come visit us and see how this works on the ground.
In Haiti?
Yeah, you'll see a huge breakthrough in the way it works.
Okay. Cool.
You can't do that before Saturday, so.
No. Well, nor am I. I'm not conducting the listening event. No. But I'm really open for input on that.
Well, I'll send you an email. I don't know if I could do it. I'll have to look and see when I could do it. I could do it maybe tomorrow morning.
Okay.
We have one of the things I'd like to do is keep these to a little over an hour, and we're a little bit over that. But Steve had one question that he put up on the chat. Did you get to see that?
I didn't, but I can look it up. Where's the chat? Why don't you go ahead and say it while I'm...
Okay, this is from Steve. Great work, Heidi. One other funding query. You mentioned EWB was mostly doing fundraising to pay for travel costs of their engineers. How would that compare to the fundraising that Rotary groups or church-connected groups or other clubs are doing?
Yeah, so we're the Freshwater Project's the implementing organization, so I have to be really careful, conflict of interest with Rotary. But since, I kind of approach it as I'm a Rotarian, so I know the process, but we're going through 5450 at one of the health centers, Makanda, this one, we did it was a Rotary project. And so it was a district match. I think it was $12,000 for the whole thing. And these were the clubs that were involved. Yeah, I mean, EWB, it depends. Sometimes they, they'll find some donors of theirs for some of the individual projects, and we have to match it. But I kind of just look under every stone that I can for funding. So we've met with, some Malawian companies. Press Trust is, they own the Bank of Malawi, and they're the largest company in Malawi, and we're partnering with them on at least 2 health centers this year where they come up with 50%. EWB just kind of covers their cost of, I believe it's travel and time for the engineers, and then and the engineers obviously donate their time and expertise, and then and some of the daily expenses, I believe, and then there's a portion that we have to raise, whether it's through a Rotary or private group, usually to pay for the materials. So the Lacoma Island, I'm looking, through, because of the Anglican connection, and because I go to an Episcopal church, that's a grant that's will be led kind of similar to the Rotary structure, but be led by the Colorado Diocese, and then working with the Diocese of Northern Malawi as kind of our on-the-ground partner, and the funding will go, through the 2 dioceses, and then we'll again just be the implementing partner in that.
So Heidi, I have one more question on the chat from Biniam. Know if you have tried to engage the community to cover part of the project, maybe less than 1%, even this will create a good sense of belongingness. Does the community pay any portion of the project?
I'll have to find out. I know that was a discussion from the get-go, and I'll have to see what we decided with the DHO and Zomba. I know that was a component of it. But is 1% kind of the standard, or, I mean, I know with Rotary, the local club had to have buy-in, but that's not the same as the community that's actually utilizing.
Yeah, I'm just suggesting 1% maybe.
Yeah, and I think my understanding, I'll have to look back at the program. I think that they did have the community contribute, but that goes into a fund that's run by the HAC, the Health Advisory Committee, for maintenance or repairs.
Goes to the point of skin in the game.
Yes.
Has a follow-up question. He was clarifying that what his really question was how much of the fundraising goes towards travel costs versus equipment costs versus going resupply of the consumables.
Yeah, usually it's Freshwater's focus is providing funding for the materials. In the case of Press Trust, this latest project that we're doing with them, they were in charge of purchasing the materials. And then that ended up really being a lot of red tape because they have a very complex procurement process. So usually we have to come up with the cost of materials.
I think that brings up a really interesting point because, Rotary's, the foundation does not fund everything in this project. And when you actually, kind of develop your scope of work, you begin to, when you try to figure out where the money is going to go or where you're going to get the money, where you're going to get your money, it's good to be able to figure out, Rotary might fund certain things, but obviously it's like construction. That's not a foundation thing. or even salaries. So you look for other sources or ways of doing that. So sometimes a lot of Rotarians will sit there and just look for money, and they expect the foundation, get it all from the foundation. If the foundation doesn't do it, then maybe their project is not viable. But in reality, what you need to do is to figure out first what the scope is, what
and
parts can Rotary fund.
Is willing to pay for some of the software work, right? I mean, that they actually are willing to fund that stuff.
That's true.
The salary stuff.
Not salaries,
I
but
think
the software work, right?
Right, but that's kind of to my point, is that there are some things that the foundation will do, and you just got to clarify that, and then figure out where money is coming from. Whether it's going to be foundation work, as a global grant. Can I use a global grant for this, or do I need to look for another source for it, or whatever? But it doesn't really stop a project. It just helps you clarify on how you get your funding sources.
Yeah, and even the cool thing about this grant that we're doing through the Episcopal Church USA is that you can write in. It has to be for a new project or program. You can write in salary for a new program person, and we have. I didn't mention it in this talk, but in my previous talk, we're engaging a water technician through Core Africa, which is kind of the African version of Peace Corps. That person should be starting in February. And so my hope is that if we receive this grant, we can tie in the entire salary for that person for the year.
Yeah. And that's kind of what I'm saying, Neil. So it's not something where you say, I can't do this activity, therefore the product is not viable.
Yeah.
It's looking for partnerships beyond Rotary, even, of how you actually can fundraise or get the activities that you need to do to make that project sustainable.
Well, and that's a great, to our discussion on software and knowing Rotary's focus on that part of it. Just because we're done with the hardware part of it and we're kind of in the monitoring phase, it doesn't mean that we can't look for funding for that aspect of it through Rotary.
Right. Or another source.
Right.
Just figure out what Rotary will actually fund you for, and if it's not Rotary, it's somewhere else.
Right.
So.
Yeah. It's just finding those rocks to look under. Yeah. So.
And what baskets you put the money in.
A lot of times it's timing.
Yeah. And what baskets you put the money into.
Right.
Okay, well, I don't want to really cut things off, but I do want to respect people's time. We're a little bit over an hour and a half now, and I want to thank Heidi for her presentation. I'm glad I watched it a second time. There's a lot in there, and it's got a lot of things we can learn from as a club and share the expertise that we're learning. And so looking forward to these bi-weekly meetings, and I think we have now a record number of attendees at eClub functions this month. It's been really great to see everybody, and I'm glad that we're getting engaged and active as a club. So thank you very much, everyone, for attending, and we will have our calendar is up for February. We are going to shoot for one club member presentation and one presentation from the club. So our first in February, our first presenter will be Laura Richardson, who's doing her new member talk / introduction to what she does with O Horizons. So we will continue this, and I'm really, really glad to see the high-level participation. When the window gets so big that it has to show tiny little icons, that's a great thing. So thanks. And we'll see you at the next meetings.
And I just want to say I really appreciate and respect all of you, and appreciate your suggestions and feedback. And I'm always open to ways that we can do things better. So thanks, Bruce, and thanks to everyone for your input.
Thank you.